When we're talking about breathing easier with asthma, the big question is, when do we know that we're having an asthma attack? How do we know? And then what do we need to do?
Well, for every individual, it's going to be different. So your asthma action plan that you've worked with your healthcare provider on is going to help you identify, you personally, what symptoms that you have that trigger you to do a different intervention, like take your medication. Your quick relief inhaler, for example. There may be an indication that from your symptoms, you would need to take your quick relief inhaler more times than normal.
What are some typical symptoms that you see for people that are starting to have an asthma attack, just for example?
They might just be struggling doing the activity that they normally don't have a hard time with. They're getting more short of breath. They might have chest tightness. They might be coughing. Their chest may hurt when they breathe. They may not feel like playing when they normally do because they're more focusing on their breathing.
When do you know that you're kind of past that and you need to get some bigger help?
So when do you call 911? For one thing, if you're not sure what to do, you have an individual that's struggling to breathe, and you're not sure what to do, call 911.
Okay.
Other reasons to call 911 would be if the individual or child is unable to walk, to talk, or to take a sip of water. Also, that individual is using all of their accessory muscles of respiration or breathing. That means their neck muscles are being used. You'll see them reach out with their head, their shoulders will come up, their diaphragm will come out, their breathing muscle here will come out.
So they look like they're in trouble.
Right, they look like they're in trouble. Also, you might notice that they have blueness in their lips or their nail beds. And for a person of color, that blueness would show inside the mouth. So you'd want to look inside the mouth. And when you see that blueness, that means there's a lack of oxygen getting to the bloodstream. So that is definitely a 911 call. In addition, if you've already used your quick relief inhaler and you're not getting any relief,
if somebody's really at that point, they may not be able to seek help themselves. They're going to probably need help from a friend or a coach or anybody that's around them. Who needs to have access to your action plan?
Well, the school, and I think Lincoln Public Schools is very good about requesting an asthma action plan for their individuals that have asthma. Also, at home, you should have your asthma action plan. And then maybe your children go visit a grandma or a grandpa or an uncle or an aunt. They should have it too. And also ensure that that individual has their quick relief inhaler with them or their nebulizer, whatever it is they need to get them through a crisis.
Thank you so much, Nancy.
Thank you, Michelle.